Welcome to Anatomy. FMGE, NEAT, Next 2024. PG exclusive test series.
Today's topic is from Head and Neck. Coming to today's case presentation MCQ, is. Since 1.5 years ago, a handsome 28-year-old man has been working as a bartender in a noisy pub. After having trouble hearing for 3 weeks, he went to the otolaryngology OPD. Normal sounds are getting harder and harder for him to deal with. He also says that his ears are ringing, which keeps away from going to work and other places where people are. This person has never been sick before, and they do not take any medicines. After the otolaryngologist did a full review of the patient's hearing, it was clear that the patient has hyperacusis. Most likely, his disease is caused by damage to which of the following cranial nerves? And the given options are: A. Third cranial nerve, B. Fifth cranial nerve, C. Seventh cranial nerve, and D. Ninth cranial nerve. Clues in this case report are: 1. Noisy pub, 2. Trouble hearing, 3. Normal sounds are getting harder and harder for him to deal, 4. Ears are ringing, which keep away from going to work, and finally. Now, what is hyperacusis? The inability to tolerate loud noises is referred to as hyperacusis. It is also described as decreased sound tolerance, DST. People who have hyperacusis frequently find that even normal levels of background noise are intolerable, whereas loud noise can induce discomfort and even pain. The two most common causes of hyperacusis are prolonged exposure to loud noise and getting older. What may the cause for hyperacusis? Many factors may causes the hyperacusis are: clearing a blocked ear canal may cause increased sensitivity to the sound. Changes in the hearing due to aging, sudden exposure to loud noise, like explosion, working in a noisy environment, slap on ear, or head injury, acoustic neuroma, or vestibular schwannoma, surgery to the ear, facial nerve palsy, fullness, or pressure in ear, and so on. Hyperacusis can negatively impact the patient's mental health and social life, that can lead to anxiety, depression, relationship issues, and social isolation, or avoidance. Now coming to the discussion of given options. For option A, the third cranial nerve, the oculomotor nerve, innervates extraocular muscles of the eyeball, except superior oblique, by fourth cranial nerve, and lateral rectus, by sixth cranial nerve, and two intraocular muscles, the ciliaris and sphincter pupillae. This nerve is not strictly related to ear, so the option is wrong. The second option B is the fifth cranial nerve. Although it supplies a portion of the external ear, hyperacusis is not caused by the trigeminal nerve, the greatest general sensory and motor nerve to the head and neck region. Therefore, this nerve does not match the question. Now the fourth option D is the ninth cranial nerve. The glossopharyngeal nerve provides specialized sensory input to the posterior one-third of the tongue, motor control of the stylopharyngeus muscle in the pharynx, and general somatic afferent, or sensory fibers to the inner surface of the tympanic membrane. Therefore, this nerve is likewise inconsistent with the inquiry. At last, coming to the option C, that is seventh cranial nerve. This is the correct answer for this MCQ. Now coming to the discussion. This man had hyperacusis in this question. Hyperacusis can result from injury to either the facial or vestibulocochlear nerves. The vestibulocochlear or statoacoustic nerve is not addressed in this MCQ options, so eighth cranial nerve will not be part of the conversation. Facial nerve lesion causes facial palsy or paralysis. Facial nerve palsy can also be brought on by a number of other conditions, including diabetes, Lyme disease, shingles, and neurosarcoidosis. In contrast to Bell palsy, the facial nerve palsy that can be caused by Lyme disease can affect both sides of the face. like the neurosarcoidosis, is a common cause of facial nerve palsy, and it can affect both sides of the face. Another theory is that the facial nerve controls the stapedius muscle, which regulates sound intensity in the ear. The acoustic reflex is a contraction of the stapedial muscle in the middle ear, in response to loud sounds, or the beginning of speech. It is also known as stapedius reflex, stapedial reflex, auditory reflex, middle ear muscle reflex, attenuation reflex, cochleostapedial reflex, or intraoral reflex. Accessing middle ear function is typical with this reflex. Instead of measuring hearing threshold, it measures stapedius muscle contraction-related reflected energy. Here the middle ear, cochlea, and nerve to stapedius can be accessed indirectly. The stapes bone has a muscle, called the stapedius linked to it. Tensor tympani is a muscle that is linked to the malleus bone. The stapedius muscle is the smallest muscle that indirectly tightens the remaining two ear ossicles by distancing the stapes, located in the middle ear, from the oval window of the cochlea. At the same time, the tensor tympani muscle pulls the malleus toward the middle ear, which causes the relationship between the three ossicle in the middle ear to become more rigid. Any damage to the intratemporal part of the facial nerve, which is between the geniculate ganglion and the nerve to stapedius, could make the stapedius muscle weaker, or slow down the stapedial reflex. This is why hearing is easily damaged by quick, impulsive sounds like an explosion or gunshot, or anything louder than 85 decibel. So, C is the most appropriate response for the provided MCQ out of the 4 given options. Thank you, all.
Subscribe, leave a comment, give it a like, and share if you enjoyed it.